Good morning, students. Welcome to Bindu Dhadwal chemistry lessons. Today we will study about medicines and their types and therapeutic actions. So, chemicals that are used for treatment of diseases and for reducing suffering from pain are called medicines or drugs. Chemotherapy is the science in which suitable chemicals are used for treatment of diseases. These chemicals have specific effects and accordingly they can be classified in allopathy based on their pharmacological action. Antibiotics, the chemical substances which are used to reduce fever, are called antibiotics. For example, aspirin, 2-acetoxy-benzoic acid. Then paracetamol. In para position, we have acetamide, 4-acetamido, and this is para to ol group, phenol group. So, 4-acetamidophenol is paracetamol. Then phenacetin, we have the same group here, but in place of OH we have ethoxy group, 4-ethoxyacetanilide. These are antibiotics. Neurological active drugs. Neurologically active drugs can be classified into two categories: analgesics and tranquilizers. Analgesics, the chemical substances which are used to reduce or relieve pain without causing any impairment of consciousness, mental confusion, incoordination or paralysis or some other disturbances of nervous system are called analgesics. They can be categorized into two categories: non-narcotic drugs, which are non-addictive, which are not habit-forming, and narcotic drugs, which are addictive. In non-narcotic drugs, the major analgesics used are aspirin and paracetamol. So, aspirin and paracetamol are used not only as antibiotics but also as analgesics. Aspirin or 2-acetoxy-benzoic acid inhibits the synthesis of prostaglandins. These are compounds which stimulate inflammation to tissues and cause pain. Other non-narcotic drugs are naproxen, ibuprofen, diclofenac sodium or diclofenac potassium. So these are the structures. This is naproxen, this is ibuprofen, this group, and this is diclofenac sodium. These are non-narcotic analgesics. They are not habit forming in nature. Next is narcotic drugs. So drugs which are administered in small doses, it relieve pain and produce sleep, are called narcotic drugs. Morphine, codeine, and heroin, these are the structures. These are narcotic drugs. These drugs, though habit forming, have to be used when there is severe pain in the body, for example, in post-operative care or in case of heart attack or birth. In case of angina, these could be used as a reliever of pain. In low doses, they are used as medicines. But if taken in high doses, they can cause stupor, coma, convulsions, and may ultimately lead to death. So they are otherwise harmful and are not taken without prescription from doctor. These are habit forming and can cause bad effects also. Next category of neurologically active drugs are tranquilizers. Tranquilizers are chemical substances used for the treatment of stress, fatigue, mild and severe mental diseases. Are neurologically active drugs which affect the message transfer mechanism from the nerve to the receptor. These are used to relieve or reduce mental tension, irritability, excitement, and anxiety, leading to calmness. These tranquilizers are essential components of sleeping pills, and they act on higher centers of nervous system and are also called psychotherapeutic drugs. These are used to make the patient passive and control their emotional distress and depression and restore confidence. Noradrenaline is a neurotransmitter that plays an important role in mood changes. If the level of noradrenaline is low due to certain reasons, then the signal sending activity of the hormone will become low and the person will suffer from depression. In such cases, the patient needs antidepressant drugs which can inhibit the enzymes causing the degradation of noradrenaline. If the enzyme is inhibited, then the metabolism of noradrenaline will be slowed down, and this can activate its receptor for a longer period of time and therefore counteract the effect of depression. Low noradrenaline causes depression. Some antidepressant drugs will help to alleviate the mood. Example medicines and which are used as antidepressants are iproniazid and phenelzine. Iproniazid and phenelzine is also known as Nardil. So these are the structures. Barbituric acid and its derivatives can also act as tranquilizers. These can be categorized into two categories. One which induce sleep. These are called hypnotics, and others which do not induce sleep. These are called non-hypnotic tranquilizers. So commonly used tranquilizers are barbituric acid having 3 double bond oxygen groups on benzene, which is heterocyclic with 2 nitrogen atoms. If on this position we add 2 groups, one ethyl and phenyl, then it is luminal, a derivative of barbituric acid. If we have seconal, 2-pentyl and propenyl group, then it is called seconal. These are hypnotics, that is sleep-inducing tranquilizers. There are certain tranquilizers which are not sleep-inducing. These are called non-hypnotics. For example, chlordiazepoxide. Then we have mebrobamate. These are non-hypnotic tranquilizers. Then equivalent is also an important tranquilizer which is used when there is depression or hypertension in patient. This is its structure, NH2COO, CH2 group on either side and 2 methyl groups. This is equivalent. Some other tranquilizers are Valium, Veronal and serotonins. So these drugs can be categorized into sedatives, antidepressants, hypnotics and narcotics. So sedatives act as depressants for patients who are mentally agitated and violent. They will suppress the activity of such patients, and sedatives will give a calmness or relaxation feeling or drowsiness in the body of the patient and will help him to settle down. Examples of sedatives are Valium, and barbiturates. Then antidepressants are those tranquilizers which are given to patients with shattered confidence. These will produce a feeling of well-being and confidence in the person having depressed mood. So they are also called mood boosters. Examples are Vitamin and Cookie. Hypnotics reduce the mental tension and anxiety. They are generally sleep inducing, but in lower doses they will calm the person without inducing sleep. And narcotics act as depressants and analgesics. They reduce mental tension and anxiety, and also they reduce pain also. So antimicrobial are chemicals used to control the microbial diseases caused by microbes in the body. These can be, if they kill bacteria, bactericidal drugs. If they stop the growth of bacteria, bacteriostatic drugs. And this antimicrobial diseases can also be controlled by increasing the immunity of the body. Microorganisms which cause diseases are called microbes. Any organism which causes a disease is also called a pathogen. And in our body also we have certain agents which can obstruct the microbes from entering the body. For example, the skin is impervious to microbes. Our many body secretions either kill the microbes or inhibit their growth. For example, lysosome, a lipid splitting enzyme in tears. Then nasal secretions, saliva, fatty acids, lactic acids in sweat, and sebaceous secretions, and hydrochloric acid in stomach. These are used to protect the body from pathogens. The pathogens reach the tissues due to breach of defense mechanism and may cause infection, and the invasion and multiplication of organism in the host will destroy the normal cell metabolism and cause diseases. So in order to control these diseases, drugs have to be used. These drugs are called antimicrobial drugs. Ehrlich Paul in 1908 for his discovery of the drug arspheniamine, this drug which was used for the treatment of syphilis. This arspheniamine is also known as salvarsan. So scientists were trying to search the chemicals that would adversely affect the invading bacteria but not the host, and Paul Ehrlich could develop this salvarsan for effective treatment of syphilis disease. So he also studied that the drug is similar to an azodide in having double bonds over here. It's azodide, it's para-hydroxyazobenzene, and if we replace nitrogen with arsenic, we get this drug. So for the first time, it came into the mind of chemists that structure is also important. So just mimicking this compound, these products were made, which were also known to have antimicrobial activities. For example, Prontosil, it was the first antibacterial drug. Then we have sulfa, and in this Prontosil, this portion is an sulfa anilide derived from sulfa anilide. So it was found that sulfa anilide has antibacterial, antimicrobial properties. So all these drugs were derivatives of this sulfa anilamide. These are sulfadiazine, sulfadimidine, and sulfapyridine. These are all antimicrobial. Next category of drugs is antibiotics. These are the chemical substances which in low concentration inhibit the growth or destroy microorganisms by intervening in their metabolic processes. These are drugs that are formed from the microorganisms and are used against diseases caused by microorganisms. An important drug that was for the first time discovered invented by Alexander Fleming is penicillin, which contains this general structure where this alkyl group may be different, but the rest of the structure is a 4-membered ring containing nitrogen fused with 5-membered ring containing sulfur, 2 methyl groups, COOH, and this is an amide portion where R group differs. If R is benzyl group, it's penicillin G or benzyl penicillin. If it is a 5-membered compound with double bond on second, it's penicillin F. If it's a 7-membered linear chain, then it's penicillin K. If it's a 7-membered but with one phenoxy group, methylene and phenoxy group, it's penicillin V. And if we have an amino group on the benzyl group attached here, then it is called ampicillin. Then these antibiotics can be divided into 2 categories. One which kill the bacteria. These are bactericidal. Example, penicillin, aminoglycosides such as streptomycin and ofloxacin. And if they just stop the growth of the bacteria, then they are called bacteriostatic. For example, erythromycin, tetracycline, chloramphenicol. So this is a structure where this penicillin part has this amino benzyl part attached to it, and if this X is H over here, if this is X is H, then it is called ampicillin, and if the rest of the structure is same and if there is OH here, then it is called amoxicillin. This is also an antibiotic. So penicillin, ampicillin, amoxicillin, and all these penicillin varieties, these are antibiotics. Now, antibiotics can be further divided based on their action against diseases. If we have antibiotics which are specific to only certain diseases like streptomycin or neomycin, these are called limited spectrum antibiotics. They act only against these specific diseases, tuberculosis, meningitis, pneumonia, or local infection. If the antibiotic is effective against both gram-positive as well as gram-negative bacteria, then it's called broad-spectrum antibiotic, and it is used to treat a variety of diseases. If it is used against either gram-positive or gram-negative or only one of them, then it's called narrow-spectrum antibiotic. For example, penicillin is a narrow spectrum antibiotic and is used for treatment of sore throat or gonorrhea or rheumatic fever or local infections. So this is broad spectrum antibiotics are used against a variety of diseases. It's used against only specific diseases. It can act on both positive and negative. It can act on either positive or negative. Chloramphenicol is an example of a broad spectrum antibiotic, and penicillin is an example of narrow spectrum antibiotic. We also have some sulfa drugs such as sulfadiazine, sulfathiazole, sulfanilamide, and sulfaguanidine or sulfacetamide, which can act against bacterial diseases. For example, this is sulfanilamide and this is sulfadiazine. These can also be used as antibiotics. Next category is antiseptics and disinfectants. So, when a chemical substance is used to kill or prevent the growth of microorganism, but it can be applied on living tissues because it's not harmful to living tissues, then it is called antiseptic. And if it cannot be applied on living tissues because it's harmful to tissues and is only used to clean hard surfaces, then it is called disinfectant. There are some these chemicals which can be used to kill or prevent growth of microorganisms, which when used in lower concentration can act as antiseptic, and when used in higher concentration can act as disinfectants. For example, 0.2% phenol is used in low concentration and as antiseptic, and 1% as disinfectant. Other antiseptics are Dettol. It's a mixture of chloroxylenol and terpineol. This is chloroxylenol, and this is terpineol. Then bithionol is an antiseptic used in medicated soaps. It's added to medicated soaps. So this is repeated here. The two same groups are attached with sulfur. This is bithionol. This is added to medicated soap and it acts as an antiseptic. Then we have tincture of iodine. It's also an antiseptic solution. It's a 2 to 3% iodine solution in alcohol water mixture. Then boric acid can be used as mild antiseptic. Iodoform can be used to treatment of wounds. Hydrogen peroxide is used under the name perhydrol. Salol is used in mouth ulcers. Then KMNO4 solution, dilute solution, can also be used as antiseptic solution. Then amyl methacrosol can be used as an antiseptic. Soframycin and furosemide creams can be used as antiseptic creams to treat wounds, etc. And some dyes such as gentian violet and methylene blue can be used as antiseptics. Then some example of disinfectants are chlorine. In this concentration can be used to sterilize water. Higher concentration, it will be disinfectant. Low concentration of sulfur dioxide. Then thymol, it is a solution of cresol. Lysol is used in clearing flows. So this is a disinfectant. This is the structure of thymol. Then next is anti-malarials. So quinine, chloroquine, paraquine, primaquine are drugs which are used against malaria disease, which is caused by bite of mosquitoes. So these are called anti-malarials. Then next is antacids. We have acid in our stomach which is used for digestion of food, but when it goes in excess amount, it causes acidity, and to treat this acidity in the stomach, chemicals are used which are called antacids. Examples of antacids are baking soda, magnesium hydroxide, magnesium carbonate, magnesium trisilicates. These are used as laxatives. Then aluminium hydroxide gels, aluminium phosphates, dihydroxyaluminium amino acetates. A major advancement in the treatment of hyperacidity came when it was discovered that this enzyme histamine, it stimulates the secretion of pepsin and hydrochloric acid in the stomach. To prevent the interaction of histamine with the stomach wall, because when it will interact with stomach wall receptors in the stomach wall, it will cause the secretion of acid. So to prevent the interaction of histamine with the receptors present in stomach wall, the drug cimetidine was, it is also called as Tegamet, was designed. This results in production of lesser amount of acid. Then nowadays this cimetidine has been replaced with ranitidine or Zantac. This also performs the same function. Then a new class of drugs, omeprazole and lansoprazole, are also used as antacids. They prevent the formation of acid in the stomach. So these are better quality of drugs. Antihistamines. So histamine, a hormone in our body, is responsible for causing of allergies. A number of different sensitizing substances may cause allergic reactions in the human body, and this is due to the release of this hormone histamine. So we use drugs which diminish or abolish the main action of histamine released in the body and hence prevent the allergic reactions. For example, brompheniramine, terfenadine, also known as Seldane. This brompheniramine is also known as dimectab or dimethane. Then we have diphenylhydramine, this is its structure. Then phenyramine maleate, which is Avil. Diphenylhydramine is Benadryl. Phenyramine maleate is Avil. Chlorpheniramine is Zeet. Promethazine triprolidine is Acidil. And antazoline is antihistine. And we also have dimethindine, which is also known as Fostal. All these are antihistamines. This is chlorpheniramine, another antihistamine. This is promethazine, a antihistamine. Next category of drugs are drugs which are used to control pregnancy in women. These are also called oral contraceptives or birth control pills. These are anti-fertility drugs. So these oral contraceptives are generally formed by mixing estrogen and progesterone derivatives. Examples of these are generally steroids which control the female menstrual cycle or ovulation. So the drugs are designed. So for example, norethindrone is a synthetic progesterone derivative which can help in controlling fertility. Then ethinyl estradiol, also known as novestrol, is a combination of estrogen and progesterone derivative. It's used as a contraceptive. Then this mifepristone, it is also a contraceptive, which is also known as morning after pill. It blocks the effects of progesterone and prevents the fertilization of embryo in the humans. So this is the structure of norethindrone. This is ethinyl estradiol, and this is mifepristone. Then ormeloxifene, it's a centrochromin. It is a drug which is used by the name Saheli. It is also an important contraceptive. Then last category of drugs is anesthetics. These are chemicals which are used to nullify an area to relieve from pain. So a local anesthetic is cocaine or novocaine, whereas general anesthetic is chloroform or dimethyl and vinyl ethers. These are helped in doing local or general surgeries. Person gets induced into sleep and surgeries can be performed. That's all in today's video. If you like the video, please do share and subscribe. Thank you. Have a nice day.